In the midst of a national opioid crisis, it's really important for patients to realize that they can undergo major surgical procedures and not have to be prescribed those highly addictive drugs. Joining us right now to tell us more about a very popular option these days is a Baylor College of Medicine orthopedic surgeon, Dr. Mohammed Halawi, also a pioneer of an innovative approach to successfully offer opioid-free surgery recovery to patients. Good morning to you, and I'm really glad you're here to talk to us about this. So opioids do not have to be the answer for pain after surgery?
Good morning, Melissa, and thanks for having me. Yes, one of the tenets of surgery is first, do no harm. And I cannot think of a class of medications that has created more harm and a more devastating toll on human life like we've seen with opioids. I think the figures have been so alarming that the U.S. declared an opioid epidemic or a national health emergency. So nowadays, we can perform major surgeries such as joint replacement really without the needing for using any single opioid pill.
That is huge. So what are some steps that you're able to pull off to help patients avoid that?
Absolutely. So opioid-free surgery is a safer and much more effective approach to recovery. It's really a culture change. Unlike the traditional approach of masking pain with opioids, nowadays we really directly target pain. We use a number of techniques such as preemptive analgesia. This is a strategy where you actually fight the pain or preempt the pain right before it even starts on the way to the operating room. We also combine that with a number of modalities such as regional anesthesia, nerve blocks, and numbing medicines injected into the site of the surgery to stop pain in its track. And very importantly, the drugs that we use are non-opioid, and they attack multiple sites along the pain pathway, and they directly attack the root cause of pain, which is inflammation, and not just mask it like we do with opioids. The trick is you start ahead of pain and you continue to be ahead of the pain. No more or gone are the days of trying to catch up with pain like we did in the past.
Oh, it sounds so promising, and could really help somebody's future. Now, for someone who might be getting a prescription the old school way, perhaps their doctor doesn't know about this or doesn't offer this yet, what particular drugs do you want people to look out for? And then perhaps question their doctor and say, wait a second, is there something else we could try instead that might be safer for me?
Yes. So again, this is really a culture change. And is rooted in evidence.
Mm-hmm.
We just published, so not all patients may be able to undergo opioid-free surgery. I think there's a subset or a particular group of patients that are particularly difficult to treat their pain after surgery, and those patients are usually have either an opioid addiction problem or have been using opioids for a certain period of time prior to surgery. I think it's really important, to try to counsel those patients and try to cut down on their opioid use before surgery. And in our practice, actually, we just published a paper where we showed that about 70% of patients who were actually using opioids before surgery were able to successfully completely wean off and continue to be off opioids after surgery. So I think this is important for patients and doctors out there to know when they have those patients who have been on opioids for quite a period of time. But it's also equally important to know for those patients who have an anxiety or fear of pain, which is very understandable, that now with newer evidence-based advancement, pain should be one less thing that they need to worry about,
Okay.
and we can do the surgery in a very comfortable way.
All right. Well, we certainly appreciate your time today. It sounds like people really need to talk to their doctors about this before taking any opioid prescriptions. Appreciate your time from Baylor College of Medicine this morning.
Thanks, Melissa, and hope everyone stays safe.